ladies, welcome back to the Strong Mom channel. Today we've got Melissa Wong and we're talking all about C-section scar massage. Melissa is a pelvic health physiotherapist and owner at Markham Pelvic Health. And if you wanted to know why should you do scar C-section massage, how to do it, when to do it, when to start, what to look out for, we're diving into all of that with Melissa today. So welcome, Melissa. Thanks for being here.
Thanks for having me.
Awesome. So I want to ask you, and moms have, barraged me with a whole bunch of questions. So we're going to go through these. Why do we want moms massaging their C-section scar? And we've been seeing a lot more of this come up lately on your Instagram and other people's Instagram, which is great. So what is, I guess, the desired outcome and why are moms doing this?
Yeah, there's a number of different reasons why we want to massage a C-section scar. At the bottom line is that we want as smooth as a recovery as possible, which is why we want to be massaging it. Whether that is for aesthetics reasons to try to get the layers of tissue moving a little bit better, but also the scar can feel really numb. It can feel like weird. It can feel like a lot of people will say like it makes them nauseous when they start to touch their scar, if they have pants that are sitting on their scar. So things just often don't feel the same. They don't feel right. Whether or not, you're worrying about, like an extra pooch or whatnot, we just want the area to feel normal like it did before the C-section, which is partly why we want to start desensitizing and massaging that scar.
Right. I like that you said desensitizing it, right? Because everybody has a different sensation there. And we kind of want to exactly get it back to as normal as we can.
Exactly.
So would you recommend C-section scar massage for every mom who has had a C-section or just specific moms who are having issues?
I would say everyone would benefit from doing some C-section work, for sure.
Right. Is there anyone that would need to avoid it at all?
In most cases, no, I would say. Again, depends on the outcomes, right? If someone is not concerned about their scar, like we have lots of people that have never even thought about it. So I mean, if it's not bothering them, if it feels normal, like why go and do something if it's really not a concern or a goal? But again, having those layers of fascia and having the skin and that scar tissue as mobile as possible is really important, not only for a recovery in the early days, but even long-term function as well. And I think we're going to get into that a little bit later too.
Yeah. So and I have this with a lot of my clients. I do recommend that they do the massage, and I'm sure that's what you do too, even if they don't have the issue, because issues can crop up down the road, right? I always envision that, that web of connective tissue, and you can have adhesions. So this part of this, I guess, scar underneath the skin that you see could be kind of gripping over here and creeping over here. And we don't want that happening. So with your patients, are you preemptively massaging them or teaching them how to massage?
Yes, absolutely. So everyone that has had a C-section and that's coming in for therapy, and we're, just doing a baseline assessment, one of the things that we always look for is what is the mobility of the scar like? Can you touch the scar? Does it feel tender? What's the mobility like? Because again, we do want it to, again, you talked about kind of that webbing, things get bogged down, things get really stuck down. We want to make sure that that's not happening.
Right, exactly. Because that can crop up and have issues down the road.
Absolutely.
Yeah. So I guess to that point, is it ever too late to start massaging your C-section? Because I know that there's a lot of moms who have had, and just finding out about this now, they're like, oh man, that was 10, 15 years ago. Is it too late? Like, can I reap the benefits of this?
Absolutely. It's never, ever too late to start massaging your scar, get it moving, get that, again, the layers of fascia, everything moving a little bit better. Funny story is actually, a few years ago, I had a client who had a 12-year-old kid by a C-section. And just when I was talking to her, she was just, she happened to say, I just can't wear yoga pants, the same way. They either have to be really high-waisted so that like nothing touches it, but I just like or really baggy so that, there was no pressure on it.
Right.
And I would say within a few sessions of just getting her to start again desensitizing that scar, get it moving a little bit better, not only did it start looking better, but it also felt a lot better and a lot more normal. And again, she didn't even need to, think about, the types of clothes she was wearing anymore, because she was able to wear it all because it just felt better for her.
That's huge. Like 15 years and not, or 12 years, I think you said, and not being
Yes.
able to wear certain pants of certain height or length. That's, yeah, wow. That's, that's really
It probably
big.
happens more often than we even let on. It's just something often that we just kind of do, and we're like, oh no, I can't buy those pants, or I'll try on those pants, and I it just doesn't feel right, and we often just brush it off.
Right.
But again, people don't realize that no matter how long after, we can still get it feeling a lot more normal and more comfortable.
And I think a lot of times, number one, it's because we didn't talk about these things, or didn't hear about these things, or maybe didn't have the research 12 years ago, but also because OBs and doctors aren't really talking about it, right? It's your 6 or 8 week checkup and you're good to go on your way. And they're not really telling you. I've had clients in the same position. Why didn't my OB tell me I could start to touch it and do this kind of stuff, right?
Yeah.
So yeah.
And the point on that is, again, I think it's really important to put out there. It's not that doctors and OBs and midwives don't want to help, or they don't want to help with that healing process, but their lens is from a medical perspective, right? So they want to make sure that nothing is infected. They want to make sure that, it's not yellow and pussy, and the thing, or the stitches aren't going to open up. So they want to make sure that things are healed. They're not necessarily like their main concern is not necessarily like that long-term function of how that scar is moving around. So like really, like, they're your medical provider. They're there to make sure that the medical side is taken care of.
You're right. That's not their job function. You're right. So so let's talk about the dreaded C-section shelf, or the pooch, or the overhang. I've heard all of the comments and the slang that you can call this, where the skin gathers above the scar, and I pooch out or fold over the scar a bit. So let's take this aside. It's not related to diastasis recti, and it's not related to weight loss. Can doing the massage help with reducing that fold, overhang, pooch?
Absolutely. Yeah. So if I use my own shirt maybe as an example, right? Like, this is already a little bit wrinkled, but you can kind of see, like, if I had, say, a scar or a cut in my shirt here, and I was to sew it up, right? That, like, that hole, for instance, would be sewn up, it would be healed, like that hole would be gone. However, you can kind of see what's happening to all of the other fabric around there. It's all going to be pulled in, and it's all going to be affected as well. So that even though you have that incision that's kind of down through that midline, you can imagine that now things like the layers of fat, the adipose, like the organs, are going to sit there. And again, it's almost like things are kind of bunched up in there. But not only is that scar just happening right on the outside, you have to think that there's so many layers that are happening with the C-section. So again, often people don't realize, or the scar looks really, really nice on the outside, but we don't necessarily think of, how deep that, the surgeon needs to cut to get down to the baby, right? So they don't realize that there's 2 layers of stitching that happen right within that uterine wall. And then on top of that, they have to pull that fascia together. They have to pull the skin back together. So there's a lot of stuff going on a little bit deeper. So it's not only like I'm sewing up a hole just in my shirt here, but it could be that I have an undershirt on the inside. It could be that I have a sweater on the outside, and it's all needs to be kind of closed up as well. So that's where that extra pooch and, that things can just kind of sit, because things are a little bit more stagnant and tight in that area.
Awesome. So I know that a lot of moms will be happy to hear that if they haven't yet done any kind of scar massage, that they're probably going to get right on it. And of course, every mom will have different outcomes. You've seen it. We all know that with our bodies, because every body is different, for sure. I just want to talk. I had a client who, she started massaging her scar. I've had many clients massage her scar. One of them, she really had, I think it was probably at the very end of where the surgeon stitched up. And she said it was really feeling lumpy in that one area. And as soon as she just started massaging for 2 weeks, she was like, it's gone. That lumpy kind of feeling is gone. So she was really happy. I have another client who started to massage her and have a physio massage her. And then she started to get a keloid scar. So that's where the scar kind of really bumps up. Now, I was trying to reassure that it's not because of doing scar massage, but it's more of a genetic factor when it comes to keloids and how those develop. Are you able to speak to that? Is there any research about scar massage and keloids developing?
Off the top of my head, I am actually not aware of any research. I haven't done a lit review recently to speak to that. In my experience over, my years of treating people with C-section scars, generally, again, a lot of it is genetic, where, developing, and it's how the body heals. So often if you notice that, you tend to kind of keloid in other areas of your body, in many cases you will tend to keloid in that abdominal area, and it's not necessarily because of the massage itself. But one of the things that if you do see a physiotherapist to help work on that scar is that we're going to help inform you in terms of how much pressure to put, how deep to sink in, like what it should feel like. Because again, it is quite common for people to think, oh yeah, I got to get in there and I got to get massaging it. But again, we don't want to be irritating tissue that's not quite ready to have that force on it yet.
Right.
So it is going to be important that, the amount of pressure that you're putting is appropriate to how, where you are in your healing process as well.
Right. And how long after moms are cleared by their doctor, usually 8 weeks, how long after that do you start to do the massage?
Right away. But I'm not going to say, like, again, it depends on a spectrum, right? So right away, we definitely, like, once those steri strips are dry and they're coming off, I have my clients, right, like as soon as possible, again, start getting used to touch in the area. The same way if you have like a cut on your arm and you might say, oh, it feels kind of weird, or it might feel kind of numb, like you want to try desensitizing that tissue right away. That doesn't necessarily mean like I'm massaging the tissue. So that's where it can be a little bit misinterpreted sometimes. But like, again, we do want to start creating some neural inputs to that tissue so that our brain can start to feel, okay, like this is safe touch. It's not ooh, it's not weird, but it's try to normalize what that feeling feels like so that you can kind of progress from there to more of massage in the tissue.
Right.
Does that make sense?
Yeah. And so because I know some people, when I've suggested this, are like, oh, I don't know if I'm ready to touch that area yet. So what are some, I guess, recommendations or tactical things that you get your clients to do other than, just gently touching? What are some things ways that they can just start to gently kind of get used to not being maybe so grossed out or oohed or squeamish about it?
Exactly. Yeah. So again, right away, like I said, like your hands are probably the best thing that you can start with, right? So again, if I just even took a pen like on my arm here, for instance, right? And if this was my scar, I might even just start with like a little bit of back and forth over the scar. Even before I get on that scar, I might even we have to think that again, that everything's kind of being pulled together, right? So I might not even touch that scar, but I might even just start like an inch away and start touching that area. Again, that whole area is generally probably going to be numb right off the bat, right? So even just starting with a little bit of touch up and down in different directions, that's a really great option to try. You could use a shirt, you could use a cotton ball, you could use, your silk pajamas, whatever that is, even like, something as simple as lying on your stomach and just getting, you don't need to like push or anything. You don't need to do
Right.
anything crazy,
Right.
but just getting a little bit of pressure on that area, just getting used to that
Right.
is again, as long as it feels comfortable, in many cases, you know, it's a great way to start getting used to what that feels like.
Right, right. Yeah, I really like that point, that using something else, silk pajamas. What mom is wearing silk pajamas?
I know, right?
Buy me some silk pajamas. Silk pajamas. I've seen cotton swab, right?
Mhm.
So something, yeah. Okay, awesome. Those are really good, good tips. So can you show us and lead us through what a scar massage will look like?
So what you can, again, first of all, you might just want to start with like a little bit of, again, light touching in that area, back and forth, up and down. You might even just try like a little bit of up and down sensation. You can see I'm really lightly just sinking into my skin right now. And
Mhm.
I'm not necessarily like pushing,
Right.
okay? I would probably do this lying down, because right now, being in an upright position, like my abs are on because it needs to help me hold up. So I would definitely do it in a relaxed position. And then what I might try to do is just a little bit of like nudging the tissue almost.
Mhm.
So I'm just kind of pushing down onto that scar. If I have an adhesion, and you can kind of see like you can see the skin doesn't quite move as well in this area.
Okay.
Whereas in this area, it kind of sinks in a little bit more. So I'm just kind of paying attention to that as I kind of sink around that scar. And I might just move up and down and just kind of make sure. Often people will only focus on the above section, but we also want to make sure we're getting under that scar as well. Can you see that okay?
Yeah, yeah.
Okay. From there, I could actually try a little bit of circle. So I might sink into that scar
Mhm.
and just try some circles around.
Right.
And again, I'm trying to just get that skin moving. I'm feeling for any of those nodules that you described to
Mhm.
see, again, what does it feel like? And really, before you even do any of this, I'm going to put my face back in the camera for a second. The scar massage should never, ever, ever feel painful. So
Mhm.
you may feel that it pulls a little bit. You may feel that, you know, a little bit squeamish, that it feels weird. And that's all okay, but it should never feel painful.
Right.
Okay. If you're noticing that it's like getting, like it feels like it's going to open, if you're noticing any like red spots in the area, it's getting really irritated, that's too much. And I would back off. Okay. So we did a little bit of touching, we did some circles. Some of the other things, again, I'm going kind of from easiest to more advanced here.
Right.
You could also try a little bit of like hugging the tissue, almost like you're coming through that scar and going through there. You could go vertically up through that scar. You could go across. And again, remember, we want everything to be movable in all different directions. And
Right.
right now, again, if I'm early days, I'm not putting a lot of pressure. If
Mhm.
I was further along and everything on the outside felt like it was moving pretty well, then I might feel a little bit more comfortable to sink in a little bit more. But again, you're going based on your comfort level
Right.
and what things feel like.
So you're 1 year postpartum, right? Or not quite?
I am 13 months
Right. Okay.
postpartum.
So are you spending in that time, in that area that you showed us where it's a little bit more challenging to get movement, are you spending more of your time in that area?
In general, yes.
Right.
Again, though, that's the area that probably needs a little bit more love.
Mhm.
In lots of cases, it's the midline area, because in some cases, the surgeon will actually cut upwards. And even though you don't see it on the outside,
Right.
sometimes to create a little bit more space, they'll actually do an incision up through the midline.
Okay.
So then there can be some extra stitches in those deeper layers. So again,
Right.
maybe not on my shirt or my jacket,
Right.
but in my undershirt on the inside is where there's been some extra stitching.
Okay.
Sometimes it's off on the sides. So in some cases, it's kind of off like out towards the hip bone here.
Okay.
And that's where people will feel a little bit more noduly. And
Right.
again, often it's because the surgeon needs to adhere those stitches down
Right.
when they're doing their surgery.
Right. And is there kind of like how many minutes should a mom be doing this a day, or should they be doing it every day, 3 times a week? Or is there, kind of just like however it feels good to you?
It really depends. It depends again on those goals as well.
Mhm.
So as a physio, we're kind of prescribing things depending on someone's goals, depending on, when I'm assessing the tissue, what does the tissue look like? What does the tissue feel like? So again, there's no number,
Right.
unfortunately. We all wish there was,
I know,
right?
right? Got you. Okay. Oh, I forgot to ask, when you are massaging, should you be using oil or anything, just, dry fingers? What should we be using?
Again, depending on what the skin is like, what's going to be most comfortable though is definitely like a lotion, an oil of
Mhm.
some sort.
Right.
Sometimes I'll have people, again, if they're just in the shower washing the rest of their body, spend a little bit of extra time just around that C-section area. If you're moisturizing your body, again, spend a little bit of time. We often don't think about maybe moisturizing our stomach, but
Right.
it's a nice way as we're doing our arms and the rest of our body, give that area a little bit of love too, because it
Right.
needs it.
Yeah. Yeah. No, that's a great one. I think that's easy, right? It's easier. It's slippery. You got some
Easier.
soap. Yeah. Okay.
Absolutely, and you don't need to necessarily then find the time to get it in either, because you're already doing it with, I mean, as a mom, I don't know how much we're spending lotioning our bodies and whatnot, but if you are,
Well, if you
then
can
it's a
see
chance.
how flaky my skin is.
You got some sun this weekend.
Yeah. Yeah. Awesome. And okay, so I want to talk about years after. So what are some things that can crop up that you have seen with your clients or your patients? What can crop up, whether they did or they did not do the scar massage? What are
Mhm.
some signs and symptoms that something isn't quite right?
Yeah, we've seen, everything under the sun in terms of, often it's these light bulb moments where people are like, they won't, sometimes they don't even bring up the fact that they had a C-section and they're coming in for all different other kinds of things. And then when we actually assess them, we'll see the scar and we'll be like, oh, you didn't mention this. And we'll be, oh yeah, it was, 20 years ago. So it can range from anything like back pain, for instance,
Okay.
to urinary incontinence.
Mhm.
So again, what can sometimes happen is, again, we think about those layers of tissue, the layers of fascia, that is all affected.
Mhm.
It could be accompanied with sometimes like weight loss or weight gain, where again, that's creating different forces on that scar, because that scar may not have given the person an issue
Mhm.
until, when they've lost 20 pounds. And then now the forces on that scar are going to play a different role, right?
Right.
Those forces that are kind of coming through the uterine wall where the bladder sits, like people often don't see that everything truly is connected.
Right.
So often when we see, issues later on, it can be accompanied with, weight loss, weight gain,
Mhm.
um, could be urinary incontinence, it could be pelvic organ prolapse, it could be
Right.
back pain.
Wow.
Urgency and frequency is probably the number one thing that we see that can be related. Because again, if again you're not familiar with the anatomy, you have your uterus that kind of sits in the middle here. You have your bladder that sits in the front, and again, that scar kind of comes right through. Like this is the front of my body here. That scar is coming right through down to the uterus. Things are being stitched, and again, that can put some other pressures on that bladder, and that can create often urgency and frequency.
Right.
And true,
I have
yeah,
heard
go ahead.
stories of other physios telling us that years and years and years pass, and then that web of, tissue kind of pulls on some of the organs.
Yeah,
Right.
absolutely. And again, just a personal experience here, having gone through a C-section myself, 13 months ago, that was probably the number one thing that I noticed myself postpartum. Like luckily I didn't have, incontinence or anything postpartum,
Mhm.
but I definitely, like, usually I could hold my pee a lot better. And I was definitely getting a lot more urgency and frequency
Right.
postpartum. And like I knew for myself being a pelvic physio, like I knew that some of that did have to do with that, that scar and
Right.
probably some of the adhesions and some of the surgical procedure that happened. So
Right. Right.
yeah.
Great. So, thank you so much for giving us all this information. This is great,
Yeah.
especially I think for moms who, like we talked about, years and years down the road. One other thing that I just thought about, is
Mm.
scar massage beneficial for any other kind of surgeries? Let's talk hysterectomy. So any other kind of abdominal surgeries?
Yeah, absolutely. Again, in lots of cases, again, not even just C-section massage, we'll see people that have had like laparoscopic surgeries from, say, fibroids or endometriosis.
Right.
And again, even though those scars are very small, like a laparoscopic surgery usually involves, incisions around the belly button, and then maybe like one or two
Right.
like down here in the abdomen, for those of you who don't know. But again, it's the same thing, like cameras need to go into the area, like instruments need to go into the area. Things are still being pushed around and moved around. So
Right.
absolutely, not just C-section scar, we see it in men. So men that have had, like, say they've had surgeries after a testicle hasn't dropped, for instance, and this is, a surgery from childhood. We can see things crop up. Hernia surgeries is another big one that we see.
Right.
And again, in many cases, it's like the inguinal hernia. So it's kind of right down in the groin area. Any of the above, like any kind of surgery, definitely we want to make sure that the tissue's healing, the tissue's moving well afterwards.
Right.
So
And
thank you for bringing that up.
And I think that was important that you said the laparoscopic, because it's such small, right? Little, I just had this little surgery, right? But yeah, that can definitely have effects down the road for sure.
Absolutely.
Right. Melissa, thank you so much for, telling us all of this about scar massage. Now, where can we find you on IG and anywhere else in the social media universe? And tell us, do you do virtual consults?
Absolutely. Yeah. So we are a team of 6 pelvic floor physiotherapists. We have massage therapy. We have a psychotherapist as well. We are located in Markham, Ontario. So we serve a big portion of the York region, kind of Scarborough, GTA area.
I'll put
and
all
we
the
are
links down
doing
below too.
Awesome. And we are doing virtual visits. So if you are in Ontario, we can definitely see you for any of the above services, except for massage therapy, unfortunately, virtually. So again, if you are looking for more information, any kind of guidance, we are happy to see you virtually, if not in person.
For only Ontario residents, right?
Yes.
Okay. Good to know. Awesome. Well, thank you so much.
You're very welcome. Oh, Instagram. Yeah, you meant, sorry, I totally forgot that.
That's where we can find all your awesome reels.
Instagram, Markham Pelvic Health. Facebook, we are at Markham Pelvic Health as well. And our website is markhampelvichealth.com. So all easy to remember.
Awesome. Thank you so much for joining us today.
You're welcome. Thank you.